Well, good afternoon, everyone. We are happy today to be joined by three NU nursing alumni that all work for Travelers Insurance. So to get started, I'm going to ask each of them to introduce themselves and maybe share a little bit about their NU experience. Joni, would you like to begin?
Sure. Thanks so much. So my name is Joni Shear, and I am a medical unit manager for Travelers. I have been with Travelers for about 13 years and a nurse for over, I was just counting the other day, about 36 years. So a long time. So I have lots of, experiences to share. And I would say that, NU really prepared me so well for all of my experiences that we'll share in a little bit. And really, I'm just so thankful for that experience.
Thank you. Tyra?
Hi, my name is Tyra Hilliker. I'm a auto nurse consultant for Travelers. I graduated from NU in 1998. I have been with Travelers for just over 5 years last month. And I think NU for me, from the nursing program, with it being a 4-year program, definitely helped develop critical thinking. And then also, I would say focus for management, which is just similar to Joni, which is one of the areas that I did end up going into. I'm currently not in a management position, but I think the 4-year program and the development of the critical thinking helped me in my nursing career.
And Elena, how about you?
Hi there, my name is Elena Hayes. I graduated from NU in 1997, and I just loved my experience at NU. I returned later. I was 30 when I started the nursing program, and my skills that I received while at NU and the friends that I made were awesome. And I just remember as I was doing clinicals and different experiences, when it was seen that I was an NU graduate, I could tell that people opened their eyes, and I was even more respected for that. So I love my NU experience.
And I'll kind of throw just a question out to the three of you, and you can all choose to answer it or one. But for you specifically, why did you choose to study nursing when you chose to come to Niagara University?
So I chose nursing. You know what? I always loved helping people. So from an early age, my mother always used to tell me, whenever someone got hurt or anything, it was always Joni to the rescue. So I was always there helping them. Whether it be a neighbor that moved in, I would always be over there trying to help them. And even, friends in high school that just needed someone to listen to, always just looking to help people. And I continue to do that to this day in the role that I'm at. Tyra, Elena, anything you want to share?
I would say it's probably similar. The same thing for me. It's the nature of helping people. Similar to Joni's experience, I'm always considered the mom of my group of friends. Have been since we were younger, and still am at my current age now, that they look to me for advice, guidance. They call me for medical questions. So I think it's the same thing, the nature of wanting to help people.
My experience was a little bit different. As I said, I didn't go to nursing school until I was 30, so I'd done lots of different things prior to that. And what inspired me to become a nurse is when I had my first child, I was in labor and delivery, and I was just so overwhelmed by the care that I got from the nurses and the treatment that I received. It's like, holy cow, this is what I want to do. So after I had my baby, returned from maternity leave, I said, you know what? I gave my notice and started at NU.
Fantastic. So I think that I remember in a conversation that all three of you had previous work experience in a clinical setting before joining Travelers. So would you each share a little bit about your clinical experience, but then how you managed to take your skills and experiences and how they help you in your current role with Travelers? So Tyra, would you like to start?
Oh, sure. My career path has been a little bit different from the onset, from your typical or standard hospital settings. Unfortunately, or I guess fortunately, I've learned a lot. I had some health issues after graduating. from college. Starting to begin my nursing career, it was difficult to do things with like my hands, lifting and everything. So I kind of went an atypical course, and I started working in the field with individuals with intellectual and developmental disabilities. So that was a little bit of a different setting. I spent 15 years actively working. I'm doing per diem work there still now. And then that actually transitioned over to my career at Travelers 5 years ago. So a little bit different setting, but I did do hands-on care with individual, a lot of case management type work, the overall medical oversight of individuals that were residing with us. In that position, I also did phone triage with our staff. That also has transitioned over to Travelers, as we do have on call for our claim professionals that work with us, where they can call us and ask us medical questions, length of treatment, things along those lines. And then management. So my career kind of transitioned into management, something I may think about possibly doing while I'm at Travelers. Haven't gotten to that point yet, but it's always something that I'm keeping in the background as an option.
Perfect, thank you. And Joni?
So as I mentioned earlier, I've been a nurse for a long time. So I've had quite a few different experiences. I was in a hospital setting for quite a while, and then actually moved and worked at a physician's office. So everyone sort of thinks, oh, a physician's office, but it was actually an infertility office. So I really had some great experiences there and did things that, you know, you just don't, they trained you for it. So it was nothing that you would ever learn in nursing school or anywhere else. But because I brought those nursing skills of compassion and empathy with me, that those just really helped in that setting. I then became interested in women's health and maternal care, and worked not only in a hospital setting, but then worked in home care, seeing mothers and babies in the homes after they delivered. So that I just absolutely loved. I did that for quite a while. And then I was just looking for something that was more, more friendly to working really, outside of that setting. So I moved into Travelers. Someone told me about Travelers. When I first heard about it, I was like, what would Travelers ever need nurses for? It's an insurance company. But I was just overly blown away at the opportunities that Travelers has to offer. There's just so much that they do for nurses, and actually have opportunities for nurses, not only in management, but also in different areas of insurance. And, our company is not about, denying treatment and all of that. It's really more about helping people, from not only the nurses, but also the claim professionals, and everyone involved at Travelers is really just about helping people. So really a lot of that compassion and empathy, those critical thinking skills that Tyra mentioned, really have been helpful in terms of the transition to Travelers.
And Elena?
So after I became a nurse, I've had a lot of different clinical experiences. I've worked in cardiac intervention, med surg, long-term care. I was a nurse supervisor for a bit. I was in home care, which I really liked, like you, Joni. I enjoyed home care a lot. I liked going into people's homes, they were way more comfortable in their homes than they may be in a clinical setting. So you really got to know them and know specifically what their needs were. I just really have enjoyed the clinical experiences I've had, but I was ready to make a move. I really enjoy having a work-life balance, and moving into a non-clinical setting such as Travelers, I was able to balance my life a lot better. What I could bring to Travelers from my experience is my ability to identify what a treatment plan would be, what comorbidities might affect somebody's course of recovery, what kind of treatment sounded reasonable or unreasonable. I think I've been able to bring a lot of that to the table, and I've enjoyed the transition into Travelers.
Wonderful. So I think that for a lot of students that are considering nursing as careers, the obvious settings are those clinical settings. So the fact that all of you have had some other experiences prior to joining Travelers, I think really does speak to the opportunities that exist within Travelers. So I want to kind of backtrack for a minute. We talked about why nursing. You kind of gave an overview of your different experiences. But I do have a question for you is why Niagara University? When you were selecting different institutions to study, what drew you to Niagara? And if you had some advice to share with current or prospective students about nursing as a career, what would you tell them? So we'll start with Elena this time.
I chose Niagara University for a few different reasons. The main one was the respect of the nursing program. It is just so well known in the community, in the healthcare community. And it was also a 4-year program, which I had a number of credits from my life before becoming a nurse. So I was able to transfer those. So I loved the fact that I ended up with a bachelor's of nursing. If I were to give the nursing students and prospective nursing students advice, I would say keep your mind open. There are so many opportunities in nursing, things that you've never thought of. Take every opportunity for learning that you can. Listen to people. Find a mentor. A mentor is huge to help you navigate through the nursing opportunities. And just take every kind of learning opportunity you can, because there's just so much room to move and grow and just to follow whatever path you decide to take. You're not pigeonholed at all in nursing.
Thank you.
Mhm.
Tyra?
For me, the same thing as Elena, 4-year program, of course, which we're seeing a little bit more now. I think UB might have been the only other 4-year program in this area. Elena and I are only 1 year apart from attendance at NU. So I think the 4-year program for me, the culture of Niagara University, the small campus, I didn't want to be just a number in another program. So the small group of students, I think initially coming in, we may have had 100 students in the nursing program total. So to have those smaller classrooms, the one-on-one work, the mentorship of the nursing alumni and staff that were teaching at that point in time, that's what drew me to NU. I had the opportunity to actually live on campus my first 2 years. And then as I got into more of the clinical rotations, and some of those were a little bit closer to home, I decided to come back home. So I got to experience it on that level as well. And then I think for me, for potential nursing students and the current nursing students, it's a very challenging field. It can be challenging. School is very challenging, but it can also be very rewarding. I ended up in a career path that I never thought I would have chosen for myself. And I'm still doing per diem work in that field because my heart is still attached a little bit to that area, and it's been difficult to give up. So you may think, or you may not even know at this point in time what you want to exactly do with nursing, where you want to go. You may find your niche, and then that may change down the line. But I think one of the things, hindsight is always 20/20, that I never thought about when I picked nursing as a career or going to school as a nursing student was the longevity of the career. And although you may not be in a job that you love, something that your heart is set on, you most likely will have a career opportunity anywhere at any point in time in the medical field and in nursing.
And Joni, how about you?
So both my mother and my sister are graduates of Sisters Hospital School of Nursing. And when I was looking for a nursing school, my mother was the one really that said, you absolutely have to go to a 4-year school. We're not going to look at anything else. And so I began my search. And when I looked at Niagara University, I just felt like it was home. I walked on the campus and I just felt like I was home. It was just so small, intimate. As the other girls have mentioned, the class sizes were smaller. You knew your professors. You were able to, talk to them if you had any issues or problems. So it was really just a great, great atmosphere that drew me there. In terms of what I'd want prospective students to know about nursing is, everyone has sort of mentioned it a little bit, but just really, there's so much that you can get involved in with a nursing degree. Like who would have thought that you could work for an insurance company and really feel like you had a great job? I started out at Travelers just, doing utilization review and moved into a medical case management position and have been in a management position for the last 7 years. So I oversee a group of nurses. So there's so many opportunities there. You really have to be open-minded about the different opportunities. And I think especially this year, with COVID, and people are probably nervous working in a hospital, and will that ever happen again? And, where are the other opportunities? So I think just looking, elsewhere and seeing that there's just a vast of opportunities for nursing. And the other thing I'd like to say too is that what's nice about Travelers is we have work from home capabilities. So even before the pandemic, our nurses were working from home 3 days a week, which is awesome. And so when we transitioned into the pandemic, it was just seamless because everyone just started working from home 5 days a week, and it was awesome. And I think the nurses enjoy that. They enjoy the work-life balance that Travelers can bring. But it all started with where you went to college and how wonderful that experience was. That really helps me to continue to want to help people.
Well, thank you. I think this is great. You've definitely all given a good overview of not only your NU experience, but also the opportunities that exist. So I think that for a lot of prospective students, even current students, initially we tend to think that there is this point A to point B to get us from college to career, right? But we don't always think about that we're going to take a lot of different twists and turns along the way to finally really end up where we are. And so in career services, when we're talking to students and prospective students and their families, we really do try to highlight that we find great value in our employer partners, and Travelers is definitely one of them. But we like to present lots of different opportunities across a variety of industries for our students, because we know that major to career is not a one size fits all. And I think that the three of you really shared how that experience has been true for each of you. And it's been an individualized experience.
Yes.
The other thing that you've done a great job is talking about how Niagara fit your need at that time. And a lot of what you have said, it felt like home. It was this small environment. It just felt like it was a fit. We often use the phrase right now that we're a community of care. And so, there are a lot of people on this campus that are willing to help students, career services being one of them, but all of you as alumni, we appreciate you taking the time today and sharing your stories, because even if it just impacts 1 or 2 students, these might be things that they had not considered before. So thank you very much for talking about Travelers, talking about Niagara University. And if I happen to get any inquiries from anybody, I hope you don't mind if I reach out and kind of send a little note along if they want more information.
We'd appreciate it if you did.
Yeah,
Absolutely.
yeah, that would be awesome. Thanks so much,
Wonderful.
Stephanie. We really appreciate the opportunity.
Yeah, you're very welcome. Thank you.
Thank you, Stephanie.
Thank you,
you.
Stephanie.